Hello everyone, this is Ashraf Hassanpour from Shiraz University of Medical Sciences, Anatomical Department. This time I'm going to be talking about the different views of the skull and describing the different structures that can be seen from these views. Actually, in the previous section, we described almost all structures and features of the skull. Therefore, in this section, we are just going to review them. Now let's start with the very first topic here, the anterior view of the skull. An anterior view shows several major bones of the skull. The frontal bone forms the forehead. The left and right orbits are formed from a complex articulation of multiple skull bones. There are two large openings within each orbit called the superior orbital fissure and the inferior orbital fissure. Superior to the orbits on the anterior surface of the frontal bone are the superciliary arches, otherwise known as the brow ridges. The left and right nasal bones form the bony bridge of the nose. Superior to nasal bones and between the orbits is a landmark area called the glabella. The left and right maxillae, also called maxillary bones, fuse in the midline to form most of the upper jaw and the lateral boundaries of the nasal cavity. The maxillae also help form a portion of both the floor of each orbit and the roof of the oral cavity. Inferior to each orbit in the maxilla is an infraorbital foramen, which is a passageway for blood vessels and nerves to the face. The lower jaw is formed by the mandible. The prominent chin of the mandible is called the mental protuberance. The oral margins of the maxillae and the mandible have alveolar processes that contain the teeth. The nasal cavity is also seen in anterior view. Its inferior border is marked by a prominent anterior nasal spine. The thin ridge of the bone that divides the nasal cavity into left and right halves is called the nasal septum. Along the inferolateral walls of the nasal cavity are two scroll-shaped bones called the inferior nasal conchae. Okay, now let's move on to the next view, the superior view. The superior view of the skull primarily shows four of the cranial bones, the frontal bone, both parietal bones, and the occipital bone. The articulation between the frontal and parietal bones is the coronal suture. The sagittal suture connects the left and right parietal bones along the midline of the skull. Along the posterior one-third of the sagittal suture is either a single parietal foramen or paired parietal foramina, which serve as the passageway of the small veins between the brain and the skull. The lateral surface of each parietal bone exhibits a rounded, smooth area called the parietal eminence. The superior part of the lambdoid suture represents the articulation of the occipital bone with both parietal bones. Now, let's take a look at the posterior view of the skull. The posterior view of the skull shows a portion of the occipital, parietal, and temporal bones as well as the lambdoid suture between the occipital and parietal bones. Within the lambdoid suture, there may be one or more sutural bones. The external occipital protuberance is a prominence on the posterior aspect of the skull. Please palpate the back of your head. Males tend to have a prominent, pointed external occipital protuberance, whereas females have a more subtle, rounded protuberance. Intersecting the external occipital protuberance are two horizontal ridges, the superior and inferior nuchal line. Well, here you can see the lateral view of the skull. It shows one parietal bone, temporal bone, and the zygomatic bone. This view also shows part of the maxilla, mandible, frontal bone, and the occipital bone. The superior and inferior temporal lines arc across the surface of the parietal and frontal bones and mark the attachment site of the temporalis muscle. The small lacrimal bone articulates with the maxilla anteriorly and with the ethmoid bone posteriorly. A portion of the sphenoid bone articulates with the frontal, parietal, and temporal bones. This region is called the terion, that includes the edge-shaped set of sutures of these four articulating bones. The temporal process of zygomatic bone and the zygomatic process of temporal bone fuse to form the zygomatic arch. Please put your fingers along the bony prominence, apex of your cheeks, and move your fingers posteriorly toward your ears. You are feeling the zygomatic arc. The zygomatic arc terminates superior to the point where the mandible articulates with the mandibular fossa of the temporal bone. This articulation is called the temporomandibular joint, TMJ. By putting your finger anterior to your external ear opening and then opening and closing your jaw, you can feel that joint moving. The scamus part of the temporal bone lies directly inferior to the scamus suture. Immediately posterolateral to the mandibular fossa is the tympanic part of the temporal bone. This is a small, bony ring surrounding the external ear opening called the external acoustic meatus or external auditory canal. Inferior and posterior to this meatus is the mastoid process, the bump you feel behind your external ear opening. The styloid process is a thin pointed projection of bone located anteromedial to the mastoid process. It serves as an attachment site for several hyoid and thigh muscles. Next view is the inferior or basal view of the skull. In an inferior view, the skull looks a bit complex with all of its foramina and weird-shaped bone features. However, you will soon be able to recognize and distinguish some landmark features. The most anterior structure is the heart palate. On the posterior aspect of either side of the heart palate are the trigoid processes of the sphenoid bone. Adjacent to these structures are the internal opening of the nasal cavity called the choanine. Between the mandibular fossa and trigoid processes are several foramina and canals. Closest to the trigoid process is the foramen ovale, and lateral to this opening is the foramen spinosum. Posterior and lateral to this foramina is the jugular foramen, which is a space between the temporal and occipital bones. The entrance to the carotid canal is anteromedial to the jugular foramen. The foramen lacerum, anteromedial to the carotid canal, extends between the occipital and temporal bones. This opening is covered by cartilage in a living individual. The largest foramen of all is the foramen magnum, literally meaning big hole. Through this opening, the spinal cord enters the cranial cavity and becomes continuous with the brainstem. On either side of the foramen magnum are the rounded occipital condyles, which articulate with the vertebral column. Okay, we are ready now to move on to the next internal view of cranial base. When the superior part of the skull is cut and removed, the internal view of the cranial base relieves the floor of the cranium is not horizontal. It descends in two steps. Viewed from the superior surface, The cranial floor at each level forms a curving depression known as cranial fossa. The anterior cranial fossa is formed by the frontal bone, the cribriform plate of the ethmoid, and the lesser wings of the sphenoid. The anterior cranial fossa supports the frontal lobes of the cerebral hemispheres. Quick clinical note here that fractures in the floor of the anterior cranial fossa may involve the cribriform plate. What happens then is this may cause the leakage of the cerebrospinal fluid from the nose, a condition that we call CSF rhinorrhea. The middle cranial fossa extends from the internal nares to the petrous portion of the temporal bone. The sphenoid, temporal, and parietal bones form this fossa, which cradles the temporal lobes of the cerebral hemispheres, the diencephalon, and the anterior portion of brainstem, mesencephalon. The more inferior posterior cranial fossa extends from the petrous parts of temporal bones to the posterior surface of the skull. The posterior fossa is formed primarily by the occipital bone with contributions from the temporal and parietal bones. The posterior cranial fossa supports the occipital lobes of cerebral hemispheres, the cerebellum, and the posterior brainstem, pons, and medulla oblongata. Many of the foramina labeled on the inferior view of the skull can also be seen from this internal view, but some new openings are visible as well. For example, left and right optic canals are located in the lesser wings of the sphenoid. The internal acoustic meatus is located more posteriorly in the temporal bone. Okay, let's move on now to the next part of the lecture and look at some clinical notes. In this part, we are going to talk a little bit about facial fractures, especially Leaford fractures. These are midface fractures. Collectively, these constitute about 20% of skull fractures overall. These are due to crash-type injuries to the anterior skull. So, there are three different classifications of Leaford fractures. We have type 1, which involves the separation of the alveolar part of the maxillae from the rest of the visceral cranium. There is type 2, which involves the separation of the midface from the rest of the visceral cranium. And finally, we have type 3, which involves the separation of the entire visceral cranium from the neurocranium. It's worth noting that this is not a black and white classification system, and that there can be some overlap between fracture types. So that brings us to the end of our lecture. Happy studying and thanks for watching.